What's up, everybody? It's Monique. I'm here to talk about my new hip and flank surgery that I just got today, literally. And I haven't taken any pain meds or anything like that. I'm doing okay. It's actually a revision, but they still took out 4 centimeters, and the initial one they took out 6. So, but I'm still feeling a lot better, and it's maybe because I'm not taking the pain medication. I literally just took some turmeric, two pills that I crushed up because I can't digest like the pills. So I crushed them up in one of those things, and I also took like some green. It's like a green thing. It's like 30 calories for a scoop, but it's got like all kinds of vitamins in it because my husband just bought me some multivitamin, and it's those hard pills and I can't take them. So I just took this stuff, and it's more of like it's like green grass juice, something like that, but it's in a powder form. And then I also took some prebiotics with that and mixed it with the turmeric, and oddly enough the pain is getting better because like the numbing was wearing off, and I'm like, oh my god, please, I don't want to take the medications because I'm in school still and I need to get some homework done. So I'm like if I take it, it like affects me for days. So anyways, that's that. And if you can't tell, I'm wearing a wig, right? This is like the cheapest wig that you could possibly find, but it looks, I don't know, I just feel like I look better with thick hair. And I'm gonna be looking around for some better wigs. I got this from Shein, I think, which is a controversial place to shop. I got it 3 years ago, so I haven't really shopped there since then. So I think I would go maybe on the TikTok shop because there's a lot of good wigs that I see people wearing that are quality. But even just this crappy one, it just, I don't know. I need a wig because my hair is so thin and I just look so much better with a wig on. Like, I almost just want to wear it this whole time. I mean, it's not good quality, so it doesn't look good, but it looks better than my normal hair. Y'all don't even know. My hair is the most thinnest freaking hair like ever. It's every strand is like fine. It's not even like my hair's thinning out because I feel like my head is full of hair, and I went to go see a hair specialist and there's not any room to put more hair. It's just, it's very fine, and it breaks like halfway, even maybe even not even halfway, maybe even up here sometimes. It just breaks off. It's just so fine. But this, I really wish I had thick hair but this is like the cheapest thing. You could see all the like the dents in it and everything. And my ponytail back here is like, I didn't even flatten it. I don't have one of those I don't know, like caps. My ponytail's like sticking out in the back, but I just threw it on, and I don't know, I like to have fun sometimes. But I'll probably take it off in a minute. But I just wanted to show you guys because like I keep saying I'm going to show you my surgeries, and I haven't gotten to it. Like, I'm super busy. I'm in nursing school, and it's just like I was just so stressed out. I gained weight, and I recently been trying to fast again, like if you see my other video. And then now I was fasting for most of the day. I need to be more like I don't know, structure just to count exactly how many hours, but like normally between 5 and 6 would be the first time I would eat all day long. And I just recently lost like 12 pounds for this surgery because I was like getting close to 150, and now I'm 135. And so I'm going to continue because I want to get down to 130, and I'm really swollen, and I just think that fasting is going to help with the inflammation a lot as well. So because maybe that's why I feel good. I'm pretty, I mean, that could have something to do with it too, because I feel okay. And yeah, they said I shouldn't be sitting. I forgot. It does not even hurt. But all right, so I'm gonna show you my thighs too, because I didn't get around to showing you guys. I showed you on my initial video like my tummy tuck years ago. I showed you my thighs. So that is the that is a pre-op picture, I guess, of my thighs. And I've got my dress pulled up. I've been having my underwear off because it's just a lot easier to use the restroom. I know, TMI, but all right, so maybe if I turn the camera around, I can show you. And they're gonna revise my thighs because they're not the way that I want them to be. And they just did the revision on my hip and flanks because I showed you that my last video, kind of what the scar looked like. Because like my tummy tuck only went to like kind of like my sides, and there was a lot of like love handle fat that I didn't like, and so that's what the initial hip and flank was for. And then I still had a lot of fat on my back, sort of like it would just come over my pants, and I really hated that. So I tried to get him to go a little bit further back. I know that that would be a whole nother surgery if he did my back all the way through, because that would then be like kind of a lower body lift. So, but I think he did. I can't see what he's done yet because I literally had surgery today. It's only been, I think I got out of his office, out of his, I guess it would be his office. He's got his own like surgical room in his office, which I think a lot of surgeons have that. But I left there at like, I got home at 2, I'm pretty sure. And then, yeah, and I was doing stuff. I was washing dishes and things like that. So, okay, so I'm going to show you. Let's see if I can turn this around. This is the same problem I had last time. So I got an iPhone, and I normally have an Android. And I even installed this app to flip the camera. I'm really sorry. There's really nothing I could do, but I'll just, and I can't even see what I'm showing you. Which, well, I guess I could. That's why I got a mirror then. Okay. So you could see my thighs are even thinner than they were. But the thing I hate, this is okay, but the thing I hate the most is up here. She got my knee pretty good because I didn't want those fat knobby knees that some people get. But right here, there's still a lot of fat that they can get. And then this leg is even worse. Well, this leg is worse because she messed up my knee big time, and I'm really mad. And she actually went in to revise it, and she got fat, like, I guess right here it looks like there's a dent because she did do some lipo, and she got it here, and that did, I need it like here, right where my knee is, that fat right there, like I want that gone. And then there's also some sort of like a cyst that I keep having to massage. I look so funny with this wig. I look like, I don't even know, Aerosmith. No, not even. Sorry, Aerosmith. You do not look like this. I look like, I don't even know, some sort of character like from Kiss or something. Anyways, so, and you can see it's kind of bruised because I was using one of those rollers to maybe massage it, because I'm massaging it with my hand, and that's just, I guess, not enough. So I was like trying to use one of those rollers to you know, like, I don't know, soften it up. And like I keep trying, and she keeps telling me to like massage it, use a hot compress, and so I'm working on that. But this one as well has a lot of fat up here still. And then this fat right in the mid thigh right here, and the knee. So like it's really bumpy. So you can see the fat here, the fat here. You can't really tell, like, okay, if I jiggle this one, you can tell more of the, it's kind of hard because I've been fasting and like some of it's gone, but you can see the jiggle is just not normal. Whereas this one, it's mostly at the top where the knee looks more normal. And I just want this leg, if anything, at the very least, I want this leg to look like this leg. And then also, it looks better, I think, too, because he pulled this up. But this used to stick out, like, really crazy. And I hated it. I just wanted it, you know, and I know it's the curves, but it was this one side that it was more dipped in here, and this side stuck out. So maybe if this was fuller, that wouldn't look so bad. But there was something about it. And right now, to be honest, it doesn't look that bad like it's been looking. So Maybe in my previous videos you guys could spot it. Not that, I don't know if you care or not. But anyways, sorry. And this is my tummy tuck scar too, and that needs to be revised eventually because I have a lot of stretch marks. And those, I'm gonna get rid of those somehow. Like another surgeon I went to go see in Denver, she suggested putting fat in here to stretch the skin and then to get all this out. Because I got them really bad right here in my groin area, and it's not pretty. It's just so nice when it's natural skin here, you know, and it makes me really sad that I allowed myself to gain so much weight, but that actually happened when my first time when I was pregnant. I was 15 years old pregnant, and I was tiny, tiny, tiny when I got pregnant, and that's why I stretched out so much, because not only that, like, I was spoiled, and everybody always told me, you gotta eat for two, and nobody told me, like, you know, you need to watch your weight, you could get gestational diabetes. Nobody gave me the proper education. It was just ridiculous. But me being so young, probably the people around me were young too. They didn't know, you know, as much either. But right now I'm swollen, really swollen, like, because this morning I was like really, really small looking, but I could just see all the swelling. And so that will get taken care of, all this. And then this is just where it's at. And if it goes all the way around my back, sorry guys, then probably he got my back, and I would be so thankful because he doesn't have to do that, you know. But it was really bad. You could kind of see my crack maybe. But like I said, I just put underwear on for you guys. So this is just the revision, which, like I said, he only did 4 centimeters on each side, which he said he did 6 the first time. 4 and 6 is not that far off, so this isn't that much less than what he did the first time. But I feel so much better than I did the first time. Doesn't mean it doesn't hurt, but I might take a pain medication for just sleep for the first night, and that's it, because I'm scared. I don't want to be knocked on my butt because I have so much work to do tomorrow. I actually should be doing it today, but it's already like 10 o'clock now, almost close to. Okay, so back to me. So I've had my thighs done. I've had a tummy tuck. I have not had a revision to my tummy tuck, and I've had a revision to my thighs, which I'm going to get another one, and a revision to my thighs and to my hip and flank. So yeah, and I lost 100 and some pounds, probably. It is definitely more than 100, but I don't know exactly how much. That's what sucks, is because when I want to help people out or give information, like I'm not very structured. I just go with how my body feels. I go with life, because I'm not rigid that way. I don't know why, but I'm just not, which maybe I should be, so that I could duplicate it and help people. But like, now you can see this is super big. But all right, so look at this first. I'm gonna arch my back so that I'm not sitting all the way. So this is what it would look like if I had thick hair, kind of. Let's see. I don't know, I like it. And then without it, this is what I actually look like. Which you guys have seen me before, but my hair is so fine. Like, if I put it in a ponytail, it's so small. Okay. Ow. And like, I deal with a lot of people. When I do their hair doesn't like fall out like mine does. Mine is just falls out like crazy. But yeah, and I've been getting gray hair, so I've been using this shampoo. It's really cool because I didn't know that it would work, and it's so much better than dyeing it. But yeah, this is my hair, all of it. This is how thin my ponytail would be, which is pretty thin, and it's just like really dry and kinky. It's weird. I don't know what to do with it. I literally just put it in a bun every day. And having it down, it just looks really scraggly. I look like an old lady. Not that that's a problem. I mean, I love old women, and I'm whatever. I don't even know what to say. I just look like, let's not use old lady. I look like, I don't know, just like a character, like a witch from some cartoon or something. I don't know, it doesn't look right. And this, you could see, kind of breaks off a lot. And I remember when I was younger, I always had like this short dry spot here, and it would just never quite grow with the rest of my hair, like at the age of like my teen years. But before that, I had very shiny, long, beautiful hair. Like, it was still fine, but it was like healthy. Now, no, it's not healthy at all. But I'm gonna be looking into getting some wigs, because I've been seeing a lot of people. Well, this one lady in particular, I'm sorry, I can't even think of her name. I just found her, but she like did this. She does like a two bite burger challenge, where she'll just take like 2 bites of her burger and then throw the rest away because of her like her health stuff, like her weight journey. Like, it really helps her to not gain weight to do that. And I totally resonate with that, because you got to do what you got to do to get where you need to be in the beginning, or mostly in the beginning, or even wherever you're at in your journey. And who cares, like, who, you know, what other people have to say. Like, you just have to. You're so desperate, and like, people want to say that's unhealthy, blah 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 blah, or that's this or that's that. But in my opinion, it's a lot more unhealthy to be overweight and to be overeating, especially with our food the way it is, to be overeating that type of stuff. So I really believe that I just really believe in, I understand her method, and I believe that it works for her, and I think that it's a good thing. So, because when I started my journey, like, I had to do stuff like that too, just to trick myself, and I had to bulk my food in many ways in order to be satisfied. And people could call it unhealthy, they could call it whatever they want, but I mean, at the end of the day, it's your life, and you're the one that has to, you know, suffer with the consequences. And sometimes you just have to go with the lesser evil, you know, and it's just the way it is, because you have to, like, it's just the steps that you need to take to get where you need to go. And otherwise you're going to be stuck not making any changes and saying, well, that's not unhealthy. But nothing, absolutely nothing is going to be perfect. So whatever you choose and whatever works for you is going to be what you should go with, in my opinion. So that's what I think. And I experienced the same thing, where I had to, like, whatever food I had, like, I would take same thing, like, eat till I was like 80% full and throw the rest away. And I had to do that, especially like with restaurants or whatever. Like, I didn't take a doggy bag or anything like that, just because it wasn't healthy for me. So, because I would end up eating it later or something. So yeah, that's the way that was. But I don't know, my hair is just so thin, but you can see no gray for the most part. I used it, I want to say maybe like 2 months ago, and so it's working pretty good so far. I probably need to reapply another time, but all you have to do is put it in for 20 minutes and it works. It really works. And like, I'm so thankful, because I didn't want to have to dye my hair and keep buying hair dye and dealing with that. So I'll show you what it is too, actually. Let me see. I'm trying to think of anything else that's new that I can give you guys information on. Let's see. So this is what it's called. I got it from Amazon. It's hair dye shampoo. So I don't know. Shine Color Moisture. I'll let you see it again. Just, it's backwards, but There's nothing on the back. It comes in a box, but me being me, I don't like to keep the boxes because stuff piles up and I just hate it. I'm also taking these Shilajit, and actually I'm gonna take some right now. Well, yeah, because I took some, like I told you guys, like that scoop that I took was like had vitamins in it. I just want to make sure I'm not like double tapping on that. But these are minerals that well, obviously that you wouldn't have in your supplement. Yeah, so trace minerals and the Shilajit. So, and also I take the minoxidil. I use the minoxidil. I think it's helping. I'm not too sure, but my hair's been growing a lot. It's pretty long. Let me see. Can't really tell. It's hard to tell. Maybe you guys can see, but I can't. It's about here when it's wet, but I'd say mid back, but not too long ago I cut it like up here, maybe even up here, and it was super short, and I do not look good with short hair because I'm like I'm a more like in my opinion, which I don't know, but to me, I'm not like a thin build. I'm more of a short, thicker person, like sort of. Wide. I don't know what to call it, but that's how I feel. And like, yeah, so I don't look good with short hair. When I was younger, I did. I was very thin. Like, I was born premature and I was tiny, tiny, tiny. And I'm not anymore. Either that or it's just the skin that's on me that makes me look bigger like this. See, like, that needs to go, and I have a bunch. Not a bunch, but I have a good amount here. I want to work on my breasts. All I want is a breast lift. I don't want implants or anything like that. And if in the future, for whatever reason, like I want to get in implants, like it's possible, but I really, really want to refrain from that. But this is the hair piece I was talking about. It's always kind of been that way. It just won't grow with the rest. And then like on my back, so like for whatever he got on my back, there's still some up here where my bra's at, a little bit of fat or skin. I think it's skin, but to get that taken care of, yeah, I think those are my next steps, but it will happen when it happens. If it does, then it does. Yeah, so like that. And I talked to a hair person, and they said that, I think I seen a gray. That's why I need to redo the shampoo, but I talked to them, and they're like, well, we can't, like, if you see my hair, like, there's no balding, no, like, I guess what you would call thinning. I don't know where it would just start to, where you'd lose hair. I'm not losing hair, it's just super thin, and I don't know what to use. So if anybody knows anything about like some protein or something of like protein hair masks or hair products, I've seen them, but I don't know if they work. And yeah, I haven't bought any, and I think that's probably gonna be my next step. So yeah, sorry. I'm so sorry. So my back, my arms, my breasts, and I think that's probably going to be where it ends. But if you see my nose, that's something I want to fix too, because there's like a bump there, and if it was just like straight, that's something that bothers me. And this, and I know that's not from being overweight, but, and this too, like sometimes I'll get like a thing right here. So I don't know if it's skin or if I could use Kybella there. And then I see it on the side too, right there. This one is normally worse, but, and then this part, my forehead. those things bug me, and I always have like right here because I got a tattoo on my foot, and it hurt so bad, and I was like this, and like when I was done, there was a deep line, and it wouldn't go away for hours and hours, and like it just, I hate that. But I'm really sorry. Oh my god, I'm not trying to be perfect. There's just things that bug me, and we have the resources to take care of those things and do them if we want to. And right now I'm busy with school, but I would like to have more of a social media presence, just because like I have a lot of stories to tell. I have past that I really feel like would help people, and I've just been saying that for a while, and I just haven't gotten the chance to get on and do it, which I really should just make the time, but I have to focus on my nursing, and that to me is priority right now. And unfortunately, like I can't do it, but I have a lot of, like I said, stuff I've been through that I want to share. And being in nursing school too is just, if anybody's been through it, it's a whole nother thing that it's really hard to explain, but it's hard, and they push you like to the brink of people crying all the time. I cry all the time, and it's just a whole nother world. But yeah, so with that being said, don't want to drag this on. It's been a long video already, but if you guys have any questions, just leave it down below. And yeah, I think that is all. And I will put on another video of the healing process, or like more towards the end, because like I don't like when people post their surgery and they don't do like an update, because like more than anything, the results are the most important as far as the scar goes, and you know what it looks like. So I mean, it's nice to see the procedure and okay, you got surgery and stuff, and see the even just when it's cut and all that, and like immediately after. But you want to see like the results like a year or 2 years after, because like that's when you're really back to your normal self. And so that's why I don't post so quickly after, is because those aren't the results that matter, and not in my opinion, because when I'm looking to see what it looks like, I want to see the results, the long-term results. So because like when you first get out, it does not look the same. It doesn't. Like my belly was very jiggly. It had a lot of fluid and swelling, and like it was folded. It was really weird, and I was like, oh my god, I got botched. I was freaking out. But as it healed, it got better. And you know, who knows, that can happen with my thighs too, but that's why we're taking it slow as far as doing another revision. But I mean, I can just tell that it just needs to be fixed still, but we're still giving it time, which is fine. Like I'm not trying to jump the gun on it. But and that was done, I think my thighs were done like 6 months ago, so I feel like they healed pretty quickly. And I think my stomach was the one that took longer, is because of the muscle repair. They went in a bit deeper, and the liposuction might have been a little bit more aggressive, but I think it was mostly because of the muscle repair, so that took a lot longer to recover from. But yeah, so I'll do another video, and I have been fasting still. Like that's something I highly believe in. But it's just been mostly like pretty much OMAD, but you're still fasting till that one meal. So yeah, that's what I've been doing, and it's really helped me. Within, I think, of like 2 weeks I lost 12 pounds. So it's amazing. If you can ever like get the strength to do it, it just, that's even how I first started losing weight. In the beginning, when I was, 240, 250, 260, I don't know, I was in there somewhere. And that's kind of how I started, is watching videos on juicing, fasting, and you know, once you juice, you step down. You can step down to fasting, and it's a life-changing method, because when you eat, it keeps you in that cycle of the addiction, and you just have to cut yourself off from it, just like you would with anything else, any other addiction, like smoking, drugs. You have to cut yourself off from everybody that uses them. You just cut it off. You have to. And fasting is a gift from God that he's given us to utilize to, you know, because there's, in the Bible, it says something like, these demons, don't quote me because I don't know the exact words, but it talks about these demons can only be driven out by prayer and fasting. So there's a big reason for fasting in it, and it works, and I know that because nothing else has worked for me, and I tried everything. I don't want to say everything, but I tried a lot of things, and I want to almost say I've tried everything. And the one thing too that helped me in the beginning was Jenny Craig. The point system really, really helped, and then it went from that to juicing to fasting. So I don't know, it's been years. Like, I've been my weight for like, oh god, it's been a long time. Maybe like 2013, 2012, somewhere in there. 2013, I would say, would be when I lost my weight. So yeah, 2012, 2013, I would say 2013. So there you go. Okay guys, well, I don't want to keep you forever. Like, I want to talk, but yeah, I can't think of anything else to say. But thanks for watching, and if you have any advice for me, please leave it below. Bye.